So I am going to present the cardiac screening program of school children by echocardiography. So these are objectives: to know the exact burden of the structural heart disease among this population, and to identify the treat disease early so that they can be treated or managed well before they can develop irreversible advanced disease or any complications. So methodology, we started this program on 18th of October, and it's an ongoing project with no ending date till the death or till the life goes on. So initially started from Lahore, and I am preparing to go outside Lahore as well. High school children, all students of both genders, and echo machine I use is Canon and Butterfly. All structural abnormalities were identified on echo, including rheumatic and congenital heart disease. Echocardiographic diagnosis of rheumatic heart disease is made when typical findings are found, like valvular or subvalvular abnormalities, including commissural effusions, leaflet thickening, restricted mobility, very negative calcification. Rheumatic aortic valve, when there is thickening, restricted movement of aortic cusps, along with the involvement of mitral valve. So this is our methodology. We use butterfly probes and this Canon machine. Mainly I do them echoes on the Canon machine. More than 90% echoes have been done on the main machine, and only 10% with the butterfly, because butterfly lacks resolution, it lacks color Doppler, and it has problem in child chest, because children have smaller intercostal spaces. So this is a bulky probe. So images are not of that quality which I want. So these were the findings which we noted in our study up till now. 666 children were screened. There was aneurysmal interlateral septum in one patient, atrial septal defect with moderate pulmonary hypertension in one child, and main abnormalities were two. One was the bicuspid aortic valve, another was mitral valve prolapse. The most dangerous was in one child which was having 2 to 3 plus aortic regurgitation with bicuspid aortic valve and dilatation of aortic annulus as well. So this child is going to have problems. He has symptoms as well. And mitral valve prolapse was also very much prevalent. 7 children were having mitral valve prolapse, but luckily no one of them was having significant MR. Borderline or mild LVH was found in 2 children. Mild LV dysfunction was found in 3. Moderate TR primary without any other cause which can I find, 1. PFO in 1 children. Prominent coronary sinus 1 children. Slightly thickened mitral valve but was not fitting into the category of rheumatic. It was 1. Non-obstructive, non-regurgitant calcification of a cusp of aortic valve in 1 child. Mild AS, which was also non-rheumatic to me, was 1. PML calcification might be rheumatic, 1. And prominent cherry network in 1 child. So overall prevalence we found was 4.3%. Out of 666, 13 children were having some kind of abnormalities. The overall incidence of congenital heart disease is approximately 0.8 to 1% live births. In a study conducted in Iran, 15,130 students were screened, the same age group, school-going age group, and they used a handheld echo like butterfly, and they found out that the prevalence of congenital heart disease was around 1% and rheumatic heart disease about 0.2%. Another study was conducted in Algeria, similarly same age group, but this was a hospital-based study. The children were screened in the hospital which was suspected. This was not a community-based study. We are using a community-based study. We are going to the schools with echo machine and screening there. Rather using stethoscope, we are directly doing the echocardiogram of every child. Use that stethoscope, but don't rely on that. So this was number 6.55%, but this was hospital-based study. Already patient was suspected to have disease, not all children. So this was number is that. So our study is community-based and is having healthy school children, and the percent is 4.5%, which is very, very high. In international literature, it is around 0.8 to 1%, and it is 4 times higher. A study done by Rizvi et al. In a rural population, the prevalence of rheumatic heart disease was 0.5%. And in another study by Masood Sadiq Sahab, done in 70 schools of Lahore, 25,000 school children were screened, and all children were screened by a clinical method, and the suspected children were selected for the echocardiography. Not all children had echocardiography. And they found out prevalence of 2.19% of congenital heart disease and 1.76% of congenital heart disease and 2.19% of rheumatic heart disease. The methodology adopted by above mentioned studies from Pakistan had screened the children clinically, not by echo. So the main difference in our study and the other studies is we are screening the children primarily with the echo and main echo machine. Every children we want to have echo, because clinically and with the handheld echo machines you can miss many. So I don't want to miss anyone, and that's why 70% echoes almost are done by myself, and 90% echoes are done on the main echo machine. Only 10% echoes are done on the butterfly machine. So I don't want to miss anyone. This is a donor heart study which Nigeria has, Uganda has started. The theme is you should screen the children early. If rheumatic heart disease is picked up early, the antibiotic prophylaxis can save many lives. So this is a theme. They are doing community-based study. Every child is being screened, but they are also using the butterfly-like method. Screening the children, if they found any abnormality which is rheumatic, they put on the antibiotic prophylaxis, and the claim that we can save many lives in the Uganda by using this method alone. This is our field work. We go to the schools, we have different programs. We are running a program of school health education program, educating the children about the healthy lifestyle, because these are our future. If they are trained well in this age group, they will, I think, be away from many diseases. Clinically, we can also examine the children. This is our mobile van, which has air conditioner facilities, which has echocardiography machine can be placed inside it. There is table, chair, everything is inside. You can screen the children even in the village where there is no facility. We can use this mobile van without any other thing. And this is the echo machine. So take-home messages: the structural heart disease is much more common in our younger population as compared to the other parts of the world. Screening of the school children must be done nationwide, because this is a Pakistan Cardiology Society meeting. I will request all our seniors to please take initiative and screen the children. To know the exact burden of the disease, we can have a comprehensive data all over the Pakistan. What is the problem going on? What is the magnitude of it? And the second one, save the children, save our future. Screen the children before it is too late. Recently, I received a female. She belonged to a well-educated family, a doctor family. She was undergoing a cesarean section at a private hospital. She presented in a collapsed state in PIC. She eventually died. She had tight mitral stenosis. So she was diagnosed just before death. So we should not delay too much. Screen the children early. She was a doctor family, educated family. She might have been having symptoms of dyspnea, but someone is having, nahi ji, saans chadda hi hai, hamare vich adi khas gal koi nahi. So I think screening the children is the right time. आपको डिजीज़ बड़ी अर्ली स्टेज पे मिल जाती है, उस स्टेज पे ही उसको डिजीज़ करने का फ़ायदा है, उसी स्टेज पे एंटीबायोटिक प्रोफिलैक्सिस का भी फ़ायदा है, उस स्टेज पे मॉडरेट प्राइमरी हाइपरटेंशन है, आप आराम से मैनेज भी कर सकते हैं. पेशेंट बहुत दूर है अभी रिस्क से. जिस तरह इस बच्चे को अभी सांस चढ़ना शुरू हो गया है, जिसका बाइकस एओर्टिक वाल्व है, 2 to 3 AR है, यही अगर डायग्नोस 10 साल बाद होता तो डिसेक्शन हो चुकी होती, स्फीयर AR हो चुका होता, एलवी डिसफंक्शन हो चुका होता. सो सेव द चिल्ड्रन, सेव आवर फ्यूचर, एंड screen the children before it is too late. Next slide. You can show guys. Next slide, please. This is our study performer, and this is our team. I'm very thankful to Professor Bilal Muhyiddin, who has given me his personal echo machine for this purpose. And this is our goals. School has the education program should be started nationwide. At least we should educate our children about the healthy lifestyle. And second one, commencement of school health services all over the Pakistan. Thank you very much for patient listening, and I hope the Pakistan Cardiology Society will take initiative in this regard, so we can have a comprehensive data of our children and we can manage them as early as possible. Thank you very much.